President Mustafa, members of the organizing committee, my dear friend Dr. Sunil Richardson, members of the Great Association of Oral and Maxillofacial Surgeons of India, and their invited guests. It is an immense honor to have the opportunity to speak to this distinguished audience. Thank you kindly. We are here in Kanyakumari to advance the fund of knowledge in our beloved field of oral and maxillofacial plastic surgery. We all know that India has primacy in our fund of knowledge because Susruta, in the year 600 BC, repeat, 600 BC, designed and performed one of the first and best operations in our field, reconstruction of the nose from the forehead with a beautiful pedicle flap, which had three-dimension spatial relationships and had a very good color match. I'm proud to say that I am one of you. My personal plastic surgery lineage traces back to Vellore, South India, to the Leprosy Center of Christian Medical College, where Dr. Paul Brand and his student and my mentor, Dr. Robert Chase, helped delineate the incidence, nature, and surgical treatment of leprosy, give attention both to the physical deformity and the social stigma. Here in this video, we see an island pedicle flap of the hair-bearing scalp supported by the temporal artery and vein only, being transferred to the eyebrow to reconstruct the eyebrow after loss as a result of leprosy. Persons without eyebrows are outcasts. Therefore, this surgery was their ticket to re-entering society. Now, with your permission, I'd like to mention some of the personal motivations and values that have been important to me in my career, not from a self-centered interest, but because it is helpful to others. At the beginning of my career as a surgeon, my one goal was to have enough money from work to fulfill my dream, which was a house on the hill, children at good schools, and a reputation in the community. I mistakenly thought this was my nirvana, the ultimate achievement. I wanted to know everything in plastic surgery, to be a teacher at the university, and to be the best in the world in a small niche. On arrival at Stanford, however, I found a hospital whose only purpose was to furnish Nobel Prize caliber professors with research material. I was told, quote, "My son, your future lies in molecular biology." So I tried that. I pioneered removal of tattoos with Q-switch ruby laser, performed electron microscopy on the results, devised a test of residence in training in plastic surgery with the help of a Nobel Prize nominee in educational psychology. I did research on regeneration of the spinal cord by removing it from the cerebrospinal fluid and placing it in contact with cells with the help of a histopathology professor of very high fame. I was on my way to this goal when this happened to me. Antonio Victoria, a 14-year-old boy from Mexico who came to Stanford with a cleft lip and palate and no money. Because of his deformity, he had no opportunity for social or educational advancement. No friends, no school. I assisted at his surgical transformation. It was an instant rehabilitation. From social pariah to complete human person in an hour and a half. I derived huge income from this case. Psychic income, that is. Psychic income is the satisfaction, the good feeling that occurs when we help another person. Psychic income accrues when we practice medicine according to Hippocrates by curing pathology in a single person. While biotechnology executives and research scientists may cure 10,000 or even 1,000,000 people with one stroke of an invention or a single introduction in chemistry, they do not ever experience the joy of successfully treating a single person directly. Psychic income is the motor that drives almost every form of altruistic helping and service to other people. Because I worked hard, I was appointed Chief of Plastic Surgery at Stanford at the tender age of 32 years. My job included teaching residents and medical students. But at a research hospital with little human pathology, the source of patients was not necessarily to be extramural to Stanford. 500 miles away, I started a clinic in Mexico. The very first patient was this boy with a bag on his head because of the stigmatization caused by a relatively straightforward burn of his face. I realized that he could be cured by the skills which I then possessed at the early age of a third-year resident, a skin graft and release of ectropion. I had the privilege of the ability to change his life. I underwent a peak experience then, which is the sudden coalescence of all previous training, education, and experience into one crystal clear career path. It can be summarized as, this is what I want to do for the rest of my life. And my goal was visualized at that time. A clinic on the U.S. border with Mexico, visiting every 3 months for patient intake, with 12 operations per weekend, teaching the skills of plastic surgery 4 times a year to residents, and at the same time watching them undergo attitudinal change. That is, learning the value of helping others. This vision was eventually to have 25% of plastic surgeons in the world participating in some way at some time in international humanitarian surgery. This peak experience has stayed with me for my entire career, 54 years. Because of this, I founded Interplast to carry out the goals of training in psychomotor skills and the behavioral change in attitude. I personally have gone on 159 surgical trips with multidisciplinary teams to perform surgical rehabilitation of cleft lip and palate, of hypospadias, of burn rehabilitation, and of hand surgery. I have helped 20 Interplast organizations start up. I am here to tell you that the key to a happy career in surgery is to make room for humanitarian service. There are 2 types of income, tangible income and non-tangible income or psychic income. As young surgeons, I urge you not to worry about tangible income. It will take care of itself because we are in plastic surgery, which makes money. But to earn psychic income, we must act on the service instinct inside of us, which drives us to do things for the benefit of the other person rather than primarily in the interest of ourselves. This produces happiness in us that is secondary to the happiness in others. It is actually in the oath of Hippocrates, which we all formally have taken. I have personally witnessed similar peak experiences 39 times in my students. All of them have spontaneously expressed, "I want to do this for the rest of my life. This is why we became physicians in the first place." I am here to tell you that both paths on this road can be followed without neglecting either one. You can follow the road to provide for family prosperity, and it is still possible not to neglect the humanitarian aspect. As many have said, the money will come, but the key to a satisfying career is humanitarian service. Doctors in the United States, while well paid, are unhappy. A recent poll showed that 70% of American physicians are unhappy in their jobs, and 40% would not recommend a medical career to their own children. Contrast this with 100% of people on humanitarian medical missions that are smiling and happy. The wealth that derives from psychic income is on a much higher level than material wealth. Humanitarian work is most fulfilling when it is done, number one, gratis. Number two, it addresses significant world problems. And number three, inspires the recipient to help others in their turn. Here in India, you are in control of the first element by choosing to provide your services for free to those who are in need. India has the second element, which is the benefit of rich human pathology right on your doorstep. And the third element will be a natural result of your good deeds. This is the key to happiness in your careers. The concept of karma, which originates in your culture, also resonates with us in the United States. We also believe that as one gives, so one shall receive. A dear colleague of mine from India tells me that free camps, during which surgeons such as yourselves offer your talents to those in need, are common in your country. I believe that these camps are a model for the rest of the world. We can all learn a lot from the framework that you have established for helping people. With such excellent people and such outstanding talent in medicine, I believe that India will become the world leader in the field of oral and maxillofacial plastic surgery in the future. Thank you very much. It has been an honor to speak to you all. Hope to talk to you at coffee break.